Good afternoon, and thank you for meeting with me today. I really appreciate every one of you for joining me this afternoon for this presentation. Without taking much of your time, I will delve right into the um, information that I have for you today. The main goals of this presentation is to provide an overview of HTB and the program and services that are available, to outline environmental factors and based on the HCP performance, to provide a SWOT analysis and outline the mission and vision with the current and new proposed strategies, to provide strategies for the next 5 years, to provide an action plan and evaluation process of the plan. So, HEB is a charitable organization serving the Midwestern County of Brookfield through public health promotion and wellness programs. We currently serve about 85,000 people in this community, most of who are in blue-collar jobs. For example, farming, they own small businesses, small manufacturing businesses, agribusiness jobs, and more. This community really doesn't have a whole lot of public health resources, and this is why HCB is striving to provide these traditional health programs. So the programs we do offer and services include prenatal, newborn care, primary care, medical services for women, employee health and wellness services, case management services for the elderly, violence prevention programs, mobile health medical services, after-school programs for teens, diabetes education classes for new patients, smoking cessation classes, well water testing and water problem mitigation, as well as immunization services. In this case, when it comes to environmental factors, HCB community believe that the general community does not understand our mission and our vision. The community is expecting HCB to be specific with its goals, how things have changed when it was under a county-sponsored visiting nursing, the nurse agency, the VNA. They also have the opinion that law enforcement does not support the violence prevention programs that we offer here at HCB. Primary caregivers see the mobile health van services as a redundant program. There are also concerns that HCB does not have enough resources for the low-income communities and depends solely on grant funding as well as county budget allocation. They also have concerns that HCB does not have stable employment cycles. Other factors that have been brought to our attention is that we have failed to meet certain health accreditations and lack definite funding sources. Employees are not quite clear on our organization goals, vision, and missions. So I intend to dispel some of these concerns and talk about what we are going to do to facilitate change in HCB. So let's first talk about strengths and weaknesses. Our strength right now is that our community members are eager to be associated with the HCB. We have a competent financial officer who is capable of writing grant proposals. We have provision of a variety of programs and services as well as a nutritional education program. We also have a number of employees who are easily manageable and we can afford to pay. Now, our weaknesses right now is that we don't have a strategic plan that was developed during the formation of HCB due to its foundation as a visiting nurses agency. We lack a solid long-term financial plan to enhance operations once our $2 million grant is over. We have not been able to retain competent staff following high turnover rates. Our staff currently are being overworked, and that has also contributed to low quality of care. We have failed to meet the objections of our operations as outlined in our mission and vision statement. So that being said, let's talk about opportunities that we have as an organization and the threats that we face. The opportunities are that we currently have a strategic plan that focuses on acquiring grants for meeting organizational programs. We will contract with the county health department to fund public health programs. We have the opportunity of funding from the county of Brookfield to meet our current health wellness programs. We have an experienced executive director who has adequate knowledge of public health issues. Our director's intention is to review the organization's programs that we currently have and make sure that they align with the current vision and mission statements. We also have qualified staff members who are capable of providing effective services. Now, the threats we have is that we do not have enough funding for diabetes education classes, and the water testing mitigation might be coming to an end, will be coming to an end in 3 months. We are facing a possible reduction in administrative costs. Our prenatal and newborn care services, smoking cessation classes, immunization services are not currently meeting accreditation requirements, and that is making us very vulnerable at this time. We do not have clear definitions of our organizational operations, and this is really confusing to our community about the programs and services that are being offered. The public and board members are not quite clear on our organization's mission statement. So let's talk about our mission and vision statement. Our current mission statement is that as a non-profit organization, Health Community Brookfield, HCB, strives to improve the community's health by strengthening the quality and performance of health promotion and wellness practices through outreach, provision of services, and ongoing education. Our vision is that as a non-profit organization, HCB promotes healthy practices which can lead to improved health behaviors, healthier individuals, and healthier communities. That being said, we are proposing that we modify this mission statement as a reminder that when difficulties are experienced, it can also serve as an encouragement to stakeholders. So these are the proposed mission and vision statements, okay? The mission statement is promoting healthy living and reducing medical expenses to the Brookfield community. Our vision statement has also been modified to this: a collaborative and valued community health partner. How do we intend to come about these changes? Our intention is to forge better community relations and meet public health standards within the next 5 years, and this is how we will do it. We will draft a new strategic plan that is in line with our newly proposed mission and vision. We will collaborate with county health facilities and private health providers to avoid duplication or redundancy of health services such as the diabetes program or prenatal and newborn care. We will engage the county officials in budget allocations of the county fund into various programs, and we will develop new ways to source funding for better services as well as offer stable employment cycles. Our action plan involves the following activities: drafting a new strategic plan with participant boards, executive staff, and major stakeholders. We will scrap away redundant programs. We will consolidate and merge related departments. We will orientate the new strategic goals to the employees, and we will have an area of specializations for our employees, and this will come through the Director of Human Resources. Stakeholders outreach and orientation to the strategic plan is something that the board and director will try to work on through our public relations officer, financial accountability and proper allocations by vetting in a financial director. We will separate our nursing and quality improvement to ensure that programs are well monitored for public health accreditation. And we will implement the new strategic plan through our board directors, executive directors, program managers, and other employees. We will be running a situation analysis for every year until we meet the standards. We will compare yearly performance against set thresholds. We will compare budget allocations to actual expenditure. We will compare set and actual completion times of various projects. We will identify, modify, and continue actions where needed. So in summary, the board will facilitate adoption of proposed vision, mission, and goals of new strategic plans. We will create better public relations. We will define new avenues for funding, reduce redundancy, develop a financial control portfolio, develop action plan, implement and evaluate the action plan. So again, I want to thank you for joining me for this mission. I will be sending out this proposal to you all in an email, and so that you will have a chance to review everything and come up with any questions that you have for further discussion as we work towards these changes. I welcome any questions and appreciate everybody for being a part of this meeting. Thank you.